and I'm going to start. And you're live now, so if you want to start the meeting, Councillor Mosquito, over to you.
Thank you. Welcome, members of or constituents of the Bordesley and Highgate ward. I've been calling it Borgate, but I don't think Albert Bohr likes that phrase. Welcome to our very first meeting. And I want to inform you that you can actually ask questions in the Q&A box, which is on the right of me. I must inform you that this meeting is being recorded and you can listen to it at a later time. The first item that we have on the agenda is a presentation by Mark Gamble, who's the development manager, and he's going to talk about the East Birmingham Inclusive Growth Programme. Mark, over to you.
Thank you, Councillor. So that's right. I'm going to tell you a bit about a piece of work that I'm involved with and about a document that we've been out to consultation on recently. I have some slides to share. As I go through them, I'll be talking about various different things. But if anyone wants to come in with questions, then I'm more than happy to pause and to discuss things as we go. I haven't done a presentation quite like this before, so I'll try and spot if questions pop up. But if I do miss you, then I apologise. So first of all, I'm just going to share my screen. Okay, I think my children are knocking on the door as well, so if there's any noise in the background, I apologise. So the subject of discussion is about the East Birmingham Inclusive Growth Strategy. This is something that actually it's got a lot of history. I think we've been talking about East Birmingham and North Solihull for many years, but in recent times we've been looking at the future of East Birmingham in the context of all the things that are happening at the moment, including High Speed 2, the things that are happening in the city centre at Curzon, all of the development that is proposed in Solihull near the airport, and how we can make the most of those opportunities for the area. So we've started that by publishing a draft strategy, the intention being that that is a talking point. We wanted to come out to the community to talk to as many people as possible, to get people's views so we can make sure that the strategy is in tune with what the community wants and that we've got everybody's opinions, we've taken it all on board. So the background is that East Birmingham and North Solihull for many years now have had issues of deprivation and poverty that are worse than many other areas in the city. Now, East Birmingham is a big place and there's lots of different areas within it, and these things are not the same everywhere. But generally speaking, when you look at things like health and education, people's chances of getting a job and how much they earn, they're generally not as good in East Birmingham as they are elsewhere. And when you look at the stuff on the right-hand side of this slide, I think that gives you some information about that in terms of what that means. And for me, the biggest thing and the thing that really sticks with me is those numbers at the bottom, is that people in Heartlands ward on average can expect to live 10 years less than somebody in Sutton Four Oaks, which is clearly a really terrible, quite frightening statistic. And that's really what we're trying to do something about. So with that said, it's definitely not all bad. East Birmingham's got so much going for it. It's a huge place. It's got a population only slightly smaller than Derby, bigger than most UK cities in its own right. Parts of East Birmingham have the youngest population in the country, with more children than anywhere else. So there's all that vast potential of young people to tap into. And there's a lot of really good stuff going on. There's lots of great community organisations. There's some great businesses, there's some great local centres. So we want to build on all of those positive things, but take advantage of the big opportunities that are coming to the area to make sure we're delivering benefits for local people. So we published the document in February this year, and the plan was to get out into the community, to meet as many people as possible, we wanted to be coming to meetings and coffee mornings and anything we could. Obviously, the problem with that is that a few weeks later we went into lockdown. So we've been doing our best, and we've spoken to a lot of people. We kept the consultation open until just a few days ago, and we've been having lots of meetings with groups and organisations. As I mentioned, the area's got a large population. It covers 20 wards and parts of 4 different parliamentary constituencies. And one of the issues we've got with East Birmingham is that it's such a big place that we're starting off by making a strategy talking about how we can approach the whole area and what the big moves are, the big opportunities. But we really want to get into the local issues. So I'm from East Birmingham, I come from Hodge Hill, and growing up, I wouldn't necessarily have been thinking too much about Nechells or Shard End. And I know that that's, most people tend to think on the level of their neighbourhood or their ward. So we do talk about East Birmingham as a place, but really we know that when we're talking to local people, we really need to get into the detail of more specific, smaller places. And in the same way, we need to look at the long-term things like the metro, but we also need to be thinking about what can be done quickly. And where we are at the moment with this work is looking at how we can really start delivering and showing improvements as quickly as we possibly can. So when we were thinking about East Birmingham, we divided it into these 5 areas. It's interesting to compare how they differ from each other. For example, inner East Birmingham, and I don't know if you can see my mouse, but inner East Birmingham here, that has a very young population, whereas outer East Birmingham, generally the population is much older. And there are various patterns across the area like that. That means that those areas are quite distinct from each other. But within those, of course, there's lots of different wards, lots of different places. So when we were thinking about what needed to be done to make East Birmingham a better place for everybody, these were some of the key things that came out of our discussions, and the people have told us are important to them. So I work in the planning department of the City Council, and we've done growth strategies before for parts of the city, and the focus has been on about building homes, improving transport, bringing in investment. Where the East Birmingham work is different is that, as well as those things, we're also looking at everything else really. So health and wellbeing, employment and skills, and also thinking about local centres and green spaces in a wider way. So what does the community want? What do local people need? How can we support people to do more with their parks, with their local centres, etc. So we're trying to take a much wider approach. So within that, when we talk about things we might do or that we need to look at, education, skills and employment is, I know from the consultation, this is a really important issue to people. It's how good the service people get from the education system is. It's about how easy young people find it to go on to get jobs, what kind of training they can access, and also what the careers opportunities are in the area. So we've got various ideas about things we can do about that, supporting local businesses, connecting people with the new job opportunities that are going to be created in and around East Birmingham. This is obviously even more important now than it was when we wrote the document, because the COVID-19 pandemic has put a lot of people out of work. It's destroyed a lot of businesses. So we knew that it was a big issue already, but it's clear that now that it's really, one of the absolute key things that we need to be doing things about straight away. Health and wellbeing. I mentioned earlier on about the life expectancy difference between some parts of East Birmingham and the rest of the city. So there's lots of different things that go into that. It's to do with air quality, it's to do with the quality of the healthcare people can access and getting to the local hospital. all sorts of things contribute towards people's health, and this is another reason we need to look at this from all different angles. So part of that is about how we can help people to eat better, and I know Justin Varney, who I think is on after me, he's very passionate about that. But it's also about the transport system, it's about reducing air pollution, and it's about making sure that health and social care is working better, and that the community is playing a bigger role in that. So we talk about social prescribing there. That's the part of that idea, is that quite often people's health can be very poor if they're lonely and isolated. So sometimes someone can be much better and much healthier if they are if they're advised to go and do certain activities, like join a club, go and do something that's social, or go and do something outdoors. So there's more to it than hospitals and doctors and things like that. Transport and infrastructure. Getting around East Birmingham can be a real challenge. I think some routes are better than others. So getting into and out of the city centre can be easier than moving north and south. So if you need to catch number 11, for example, it can take you a long time to get where you want to go to. And then traffic's a big issue, parking's a big issue. And for those of you who've seen our transport plan, which was published recently, you'll know that we need to make a big change in the way people move around the city. We can't fit in any more cars on the roads. We really need people to be walking, to be cycling, to be using the bus. That's part of the reason the planned tram route through East Birmingham is so important, because it will provide a fast, clean and reliable route and connect people with the city centre and out to Solihull. So, but it's the combination of all those things. We need to do all of that, and some of those things we can do quickly. Some of them will take a lot longer, like improvements to the rail network, for example. But it is part of the plan, even if it takes a long time. Local centres and green spaces. You can see from the plan, there's lots of different local shopping centres in East Birmingham, and there's a lot of green space, and you can see the Coal Valley running right through the middle there. Making the most out of these things is really important. I think local centres were already changing because of the way that retail has changed over the last few years. Once again, the pandemic has changed that again. It means that it's even more important than it was before for us to be looking at local centres, like Small Heath, for example, and thinking about how we can make these places give as much to local people as they can do. So you want good shops, good facilities, they should be clean and safe and well lit. The transport should be better than it is now. And wherever possible, there should be opportunities for the community to do things with their local centre, whether that's about a community space to do things, or whether it's about social enterprises and all the imaginative things that communities want to be doing in their area. The slide mentions heritage as well. I think that's really important. I think there's a lot of historic buildings in East Birmingham, and there's some rich history as well. So we've all seen the media coverage of Peaky Blinders, and whatever your view of the show, it's attracted a lot of attention actually to the history of the area. A lot of these local places have things about them that are special and that are worth celebrating. So wherever possible, we want to make more of those things. So in terms of the consultation, I mentioned that we'd had to change our plans. So we did all these things that are up on the screen. We had a launch event at Southampton City College, Birmingham, and Liam Byrne kindly gave a speech there and helped us to relaunch that with a bang. We've consulted a lot of people directly by sending them information, and wherever possible, we've also worked with organisations that represent people in the community or are connected to people in the community. We've asked them to pass the information on for us. So the Asian Chamber of Commerce, for example, the Federation of Small Businesses, Heartlands Hospital, many other organisations, small and big, have helped to circulate information about the strategy and to ask people to get involved and to tell us anything they want us to know. And we've been asking for people's views about what do you think are the best and worst things about your area, and what do you think we should be concentrating on, and also in the future when we come back to do projects around the area, if people want to get involved, then that's also something we want to know as well. Because one of the key principles is we really want to be working with the community. So it's not about the council coming and doing things in East Birmingham. It's about us setting things up so that we can work with local communities as part of a team. And we really want to be making sure local people have more influence and more control over the things that are happening in their areas. But to give you a flavour of the people we've been talking to during lockdown and afterwards, these are some of the organisations we've had meetings with, and in many cases we've had several meetings, or we now have like a regular attendance at some of these organisations' events and steering groups and coffee mornings and whatever else. So the idea there is that although the formal consultation on the strategy is coming to an end, we don't see it as the end of the engagement. That was just the start. We've published the document, we've asked for people's comments on it, but it was a 20-year plan. I'm just going to stop the slides. It was a 20-year plan, and what we want to do now, as we start getting into the delivery phase, where we're putting together projects and we're coming out and doing things, we want to build on this start we've made. We want to be always talking to ever more people, giving them the chance to be involved, making sure we're communicating well, and that everybody knows what we're doing and how they can get involved. So in terms of today, as I mentioned, formally the consultation period's closed. However, we're still listening, and if anybody wants to get in touch with me to talk about this, or would like me to send you more information on this, then that'll be brilliant, and I'll definitely welcome any comments anyone has to make, and I'm happy to take any questions anyone might have now as well.
Thank you very much, Mark. Well, I'm pleased that you are still, even though the consultation period is closed, constituents can still get in contact with you via the council, obviously. One of the things that came up, a question that I thought about, was the cultural barriers. What do you think cultural barriers have been in terms of the consultation? Because I've noticed that there aren't many community or voluntary organisations. I see C for Fireside and I see the Green Lane Mosque, but there are numerous other organisations in that very vast area of East Birmingham, which I've got to admit, I didn't realise I was part of until today, because I kept on getting these emails about East Birmingham and these meetings. I thought, I'm part of Ladywood. So I don't think I was told, as the sole councillor for Borgate, that I was actually in the East Birmingham area. But it just clicked that because I've got a bit of Bordesley green, that's probably why I've been included. I certainly didn't see Nietzsche's as being part of East Birmingham, because we still think of ourselves as being part of Ladywood. But it's useful now to know, so thank you very much. And so there's that question, and then you talked about the health implications. Now, the fact that the clean air zone covers the whole of the ward, but then you're going to have the health implications of those cars on the border. So you're going to have all those cars that don't have to be compliant in those other parts of East Birmingham. And I know you can't really answer this question, but I would say that's not, in my view, fair, but it will have health implications when the cars can't go into the centre, but because of the clean air zone, around the ring, around the outer edges of the clean air zone, you're going to have people who are, as you say, young people being impacted by the cars that don't need to be compliant. So that's my few questions. Okay.
Would you like me to answer those now?
Yes, in any order.
Okay, I mean, from a cultural perspective, as I mentioned, East Birmingham is an incredibly diverse place. And the strategy talks about this to an extent. So in terms of ethnicity, the very inner bits of East Birmingham, you've got people from all over the world, and quite a lot of them recent immigrants or people who are transient and may not stay in the city very long. As you move into the middle east, inner East Birmingham, you've got more British Asian people, the population largely from Pakistani origins, but obviously not entirely. And then by the time you're out in Shard End, it's a predominantly white area. Now, you've also got a huge range of different religious beliefs, and then of course lots of people of no belief. And we've been trying to cast our net as wide as we can. So we have spoken to 2 or 3 mosques, numerous churches. We're continuing, and even today my colleague was out meeting an organisation that represents East African and Somali people in the area. We've been making links with Romanian groups as well. So we're trying to at least start the process of getting through to all those different groups. I think part of it is when we come back, and when, for example, I really want to look at Small Heath Local Centre on the Coventry Road, and to look at what we can do to improve that as one of our first priorities. When we do that, then we'd come in with a much tighter focus, and we've got a better chance of getting through to all of the local communities in that area. But that's why I say it's a never-ending task, and all we can do is to make sure we're always listening, we're always open to meet new people. One thing I would say that's come out of the online survey, possibly as a product of the way that we've had to consult, is the feedback from, it's mostly been from people over 20. So in a way, it's good that we've had lots of engagement with the strategy, but we know that there's gaps. So there's gaps with young people who can be hard to consult at the best of times. And there are gaps with older people who will have been shielding and may not have, we may not have been able to get through to. So once again, we had to close the consultation and say, well, that was what it was, but we're not going to stop. We're going to carry on, and we're always going to try and build on that as a start. Going back to the clean air zone, then I think it's a really good point, and I think the problem with something like the clean air zone is it's got an inside and an outside, and it always seems strange with that kind of thing that you've got one rule here and then the other side of the road a different one. I don't think anybody would say that was ideal. The only real solution to that is the long-term transformation of our transport network that the transport plan talks about. So we're not going to get away from problems of pollution and air quality and road safety and congestion unless we can make a really big difference to the way people move around. With all of that said, I know it's often not that simple, and if you're disabled or you've got a job that requires you to move around to lots of different places, then it's really hard to say, okay, I'll give up my car. I know it's not that easy for many people, and I think we've got a responsibility to make sure that public transport is dramatically better than it is now, that we've got safe cycle lanes, we've got good walking routes, and then by combining all of those things, then there's more room on the roads for the people who really need to drive for one reason or another. But it's a massive challenge, and I don't think anyone would pretend otherwise. There are some quite exciting ideas though for how we can start work on it, and one of the things that we're looking at through the East Birmingham programme is how we can start putting the transport plan into practice and providing some of those better facilities to make it easier for people to move around without a car.
Yes, well, I obviously would say this, wouldn't I? Because I'm the only councillor who's affected completely by the clean air zone. But I think that the clean air zone should apply to the whole of Birmingham. Why should Bordesley and Highgate be the sacrificial lamb when, in truth, the poorest people will be affected by the clean air zone, particularly on the outer rings, particularly, the Small Heath areas, all around the clean air zone, the poorest people will be affected. And I am You know, I'm a lone voice, but I have to be for those constituents who have complained to me over the past few months about the impact it's having on them. And 2 years, you know, exemption or whatever is not sufficient, because if you're living hand to mouth, and it's going to be worse, it's much worse now. There's a lot of my constituents who are at the lower end are losing their jobs. You know, they do work in hospitality, they do work as cleaners, they're losing their jobs. And so they're going to be impacted more than anyone else in the clean air zone. And jobs are closing down. You can go to the city centre and you can see shops closing down. And I don't understand why we can't be like other areas. I think Leeds has abandoned it. They said, yeah, we're going to clean, but we're not going to charge for the clean air zone. So I want it recorded, because I know that this is being recorded and it can be used for later use. So I'm not concerned about the numbers here, but I'm concerned about ensuring that my constituents are aware that I've heard what they've got to say and I back them completely. But I'm not happy with the clean air zone. I understand the concept and I do agree that we need to do something about it. But this is impacting my constituents detrimentally and disproportionately than all the others. So people who voted on this, it's not affecting their wards, but it is affecting my constituents. So I have to place on record that I've heard the concerns of my constituents, and I want them to know that I'm backing them 100%. So the next thing that I wanted to very quickly add, because we know we've got 4 minutes before Justin comes in, is just about the fact that you talked about the fact that you've been to see some of the East Africans, which is good, because one of the largest communities is those from Somalia and Somaliland and the Yemen. So that's really good that you're seeing them and you're speaking to them as well, because they do have views on this as well. In terms of you said you talked about hubs or local hubs or local community spots, which I think is a really good model as well. But the struggle that we have now is COVID, and we are not really conscious of the long-term impact that this will have on the community, because we're now finding out about long COVID. So, you know, some people have COVID, but those, and so Wade Lynn, who is the owner of Island Delight Patties, he should have been the High Sheriff from, I think, April or May gone, but couldn't take because he got COVID. He was in hospital for 12 weeks, 10 or 12 weeks. And he's out now. He had to have his throat cut, have a ventilator in, but he says he now suffers from long COVID. So in the nighttime, his fingers curl up and his toes curl up. And there are other individuals who have problems breathing, and those will be long-term problems. They're not something that can be healed. So we know also, and I'm sort of saying this because I know this is being recorded, that there are individuals who are having at the moment mental health issues. So individuals who are working from home, in isolation, elderly people, they're suffering from mental health issues as well. So, but thank you so much for all that you're doing, Mark. And is there anything else you want to say? You've got 2 minutes to respond, or 3 minutes before Justin comes in.
Just a general that I think is probably relevant to both of the things you were just saying, is one of our key aims is to tackle inequality, and inequality in all forms, whether it's discrimination or whether it's things that are less to do with society and more to do with, for example, air quality, inequality in health outcomes. So we know that COVID will have a disproportionate effect on a lot of the groups that we have in East Birmingham, whether it's black and minority ethnic or whether it's people on low incomes. We know that, and part of the reason we're doing what we're doing, and that we're going to be working as hard as we can to start bringing in money to get things done, is to correct some of that imbalance and to start, pushing the balance back the other way.
Yeah, brilliant. Well, thank you so very much, Mark. And can I remind people that they can ask questions in the Q&A box. Thank you so very much, Mark. And welcome, Justin, Dr. Justin Varney. I think, was it 2020? I think you're the most sought after, most listened to. Is it the word ubiquitous? Is that a word, ubiquitous or something? My constituents knows that I'm very, very simple, and they understand me. And so you're everywhere. I turn on the computer at this meeting, at that meeting, or I've just gone and you're there. But thank you for coming. This is quite an interesting meeting, because what I'd like you to do is just to do your presentation in the way that you've done your presentation, which I know is fully absorbing. And then if there are any questions, but I really want to do it so we can circulate it later on to those who have not been able to make it. And I have some constituents who don't know how to use computers, but can be shown this video via, I don't know if it's WhatsApp or whatever it is, but I know that I've been told that we can do something quite wonderful, and it can be circulated. So I shall leave it to you. Thank you so much for attending, Dr. Justin Varney.
Great. And thank you very much for having me, and thank you for your kind words. I think it's going to take a little while for people to disassociate me when this is all over from COVID. Feels like I have become the voice of this pandemic, unfortunately, for the city. So I'm going to talk a little bit about where we've been with COVID. I'm going to talk a bit about testing, what you can do to reduce your own risk of catching COVID, but also how you reduce your risk of becoming very unwell. I'll touch a bit on vaccination and where we're going next. And I think if you want to ask any questions, do use the Q&A function. So first of all, where have we been on COVID? So COVID-19 first appeared in the world in December 2019. So it's really important to remember this is still a relatively new organism. It appeared first in China, then spread across the Middle East, into Europe, and then across Europe, and first arrived in the UK around February. First came into the West Midlands at the beginning of March, first into Wolverhampton, and then into Birmingham around the second week of March. And what we saw in Birmingham was quite rapid rise over March, and we hit our first peak towards the end of April. Then we came down a bit, went up a bit, and had a second peak around the middle of May. And then numbers started to slowly decrease while we were all in lockdown until we came out of lockdown. And then over June and July, numbers stayed relatively low, but it's important to remember we didn't have a lot of testing back in June and July. So numbers were remaining low. And then from around the end of August, numbers in Birmingham increased quite markedly. And that's when we became, first of all, an area of enhanced support. And then we moved on as numbers continue to rise to be an area of national intervention, which is where we had the restriction on not going in and out of anyone's private house or garden. And now we are what's called a tier 2 area, an area of high alert. And there are still restrictions on not going into people's private homes. You can meet people outdoors using the rule of 6, so you can meet 5 other people. But you can't meet friends or family in restaurants. So you can only go to a restaurant or a pub or a bar with people you live with. And that's quite an important difference to what we had in the previous restrictions. When I look at the pattern at the moment, we are seeing rise across the whole city, and in pretty much every ward of the city, the numbers have been going up. And I think it's always interesting when you look about kind of who's moving faster, but pretty much every day someone moves up, someone moves down. But the general direction for the whole city is that we're all going up in the same direction. And in Bordesley and Highgate, I think you're looking at around 25 cases a week, give or take, and you've stayed around there. Sometimes it goes higher, sometimes it goes lower. But you compared to a few weeks ago where you had 3 or 4 cases a week. So you have seen the rise that we've seen across the whole city. We are moving much more slowly, though, as we go up. So we're running at the moment at about 220 cases per 100,000. But we were about 170 a week ago. So it's still a relatively slow increase compared to areas like Manchester that shot up from a couple of, they were running at about 60 per 100,000, and then suddenly they went up to 500. We're taking our time as we climb the stairs. And to put it in comparison, areas like Knowsley, 590 or so cases per 100,000. Liverpool is just over 510. So we've still got a bit of a way to go, but we're definitely heading in the wrong direction. We're just doing it much more slowly. And the reason we're doing it more slowly is because of all the hard work that you and everyone else in the city is doing to cover your face when you go out into other places, from your nose to under your chin, washing your hands regularly, not touching your face, and keeping that 2 meters of distance from people you don't live with. Those are the simple things that stop the spread of this virus. And that's one of the reasons that Birmingham is going up much, much more slowly than other areas, because we're testing more than other areas as well. And people are being good and staying at home and isolating. So if they test positive, you stay at home for 10 days, and everyone you live with stays at home for 14 days. Now, it doesn't matter whether they take a test in those 14 days if they don't have symptoms, because they still have to stay in for 14 days, even if that test is negative. If they do have symptoms and they test positive, then the 14 days, I'm afraid, restarts for everyone else in the house who isn't positive yet. So, and I know that's frustrating, but it is about stopping the spread of this virus to the people that we love and care about, to our families, to our communities, and to our wider city. So that brings me on to touch a bit on testing. So there are two types of tests. There's a test for what's called an antigen. That's the giant cotton wool bud that they push up the back of your nose or to the back of your throat. It's not very nice, but it works. And it's the most accurate test to tell you whether you have got coronavirus at the moment. So that is looking for, do you have it today? And it only tells you that you've got coronavirus on the day you take it. So if you're negative today, you could still catch it tomorrow, and you could turn positive tomorrow. And that's why it's as good as the day it's taken. The other type of, and sorry, I should say, in order to get that test, and you should only get that test if you've got symptoms. So any one of the three symptoms. So a high temperature, a continuous persistent cough, or a loss of sense of smell or taste. Any one of those, you should order a test. And you order a test by ringing 119 or by going on the NHS website and booking a test. When you order the test, they will ask you, do you drive a car? Do you have access to a car in your household? If you do, you'll be offered one of the drive-through sites. The biggest one locally is at the airport. And that's like the regional one. So it's like the gold standard one. And I have friends that have been there and say it's really, really good and it's really efficient. We also have some drive-through sites in the city. There's one at the old Tower Ballroom car park on Reservoir Road, and there's another one that's moving around a bit at the moment. And those sites are only offered to people who have a car, and they're only offered if you book a test. Don't turn up if you haven't got an appointment. If you don't have a car, you'll be offered two options. If you live within walking distance of one of the walk-through sites in the city, and we have 9 of those currently open, then you can be offered that, or you can get a postal kit that comes through the post. Now, walk-through sites slightly different from the drive-through. At the drive-through, someone does the test for you. Still not very comfortable, but they do it for you. At the walk-through sites, they can't handle the test, but they do stand there and tell you what to do. So that's the slight difference between the sites. And at the moment, there are no problems getting a test in Birmingham. Plenty of appointments available. People are getting postal kits. We haven't got a problem because we've got so many testing sites. You know, we have got, and we are going to be opening more over the coming weeks as well. We've got an ambition to get at least 12, and I'm trying to get 15. But we have been promised we'll get our 12, which is more than anyone else has got. The other kind of test is a blood test, and that's looking for antibodies. So that's looking, have you had COVID, and has your body learnt how to protect itself? Now, in general, the only way to get an antibody test is if you work in the NHS, where we're doing it as part of research, or if they, or now we're expanding that to care homes. And again, it's research. Otherwise, you have to pay for it. And it costs about £150. Now, we know from the research so far that about 1/3 of people who definitely had COVID don't develop antibodies. and of those that do, about a third their body forgets how to make them, or it doesn't make them in a way that actually works. So it doesn't make a difference to anything if you've got antibodies or not. You can't be sure they're going to be effective, so you still need to do your 2 meters distancing, do your face covering, wash your hands, don't touch your face. All of those things continue. So my advice, frankly, is don't waste your money. It's not worth it at the moment. We know that people who've had COVID back in March and April have definitely caught it again. And that's a really important message to get across. Just because you had it doesn't mean you can't catch it again. So I'll move on now to talk about what can you do to help you reduce your chances of dying or being seriously unwell if you do catch COVID. So there are 6 key risk factors. 3 of them you can't change, 3 of them you can. So the 3 you can't change, first of all, your age. I'm afraid whatever the beauty products say, your age is your age. And if you're over 80, particularly, you are most vulnerable to this. And you're much more likely to be seriously unwell or to die if you catch COVID. If you're a man, you are more likely to be seriously unwell or die if you catch COVID. And also, if you are from an ethnic community that's not white British, you are more likely as well. Now, the biological sex and the ethnicity, it really reflects the 3 risk factors that you can change, that these are more common in those communities and often not as well managed or as well supported. So the 3 you can do something about: if you smoke, please quit, or at least switch to vaping. Smoking is very, very strongly associated with people being extremely unwell with COVID. And, you know, it makes sense. We know that smoking messes up your lungs, and this is a virus that lives in your lungs. So if you've got damaged lungs, it's going to have a field day. There's lots of free support out there. Have a look on the council website, talk to your local pharmacist. We've got apps, there's free nicotine replacement. There's also free vapes available to support people quitting as well. So please do try if you can. We also know that most people take about 11 attempts before they quit for good. So if you've tried before, it hasn't worked, please have a chat with your pharmacist, because there's loads of new stuff to try and eventually you'll find what has worked for you. The second risk factor you can change is your weight. So if you're very overweight, and most of us have put on a little bit extra during lockdown, now's the time to try and get it off. Now, you're not going to lose 6 stone in the next 3 months, so don't try. Small changes, taking a walk every day, trying to do that 10,000 steps, make sure you try to avoid snacking, eat healthily. Those little things, particularly the physical activity, will really help reduce your risk. And then the third risk factor is if you have a chronic disease like kidney disease, diabetes, high blood pressure, having the disease increases your risk. But if it's not under control, that increases your risk even more. So if you've got diabetes, for example, someone whose blood sugar is really well controlled is likely to have a better ride if they catch COVID than someone whose sugars are all over the place. So now's the time to get those chronic conditions under control. Reach out to your GP practice. You know, the practice nurses, there are healthcare assistants, all of them are there to help. They want to help at the moment. So really do reach out and give them a call and have a chat about what else could you do to get your condition better under control. So those are the things you can do that reduce your risk, particularly the quitting smoking, getting more active in trying to get your weight under control, and managing your long-term conditions. All of those will make a difference. We have seen treatment improve for COVID. So there are fewer people are dying now, but unfortunately they're staying in hospital longer. We're also seeing obviously this syndrome long COVID, which is affecting people as well. That, you know, all these are good reasons why you don't want to catch COVID, and you don't want people you love and care about to catch COVID either. So that brings me finally onto vaccine before I do my crystal ball gazing bit. So vaccines take a while to develop. There's lots and lots of safety trials they have to go through. So first of all, we've got to work out, does the vaccine actually work in the lab? Then we've got to work out, does it work in humans? And then does it work in different types of humans? So different ages, different sexes, different ethnicities. So each time they kind of change the does it work test. And alongside that, there's is it safe? That's being looked at as well. So that's why vaccines take quite a long time. And on average, it takes about 18 months to get from a vaccine being needed to being able to have one that's ready to give out. So obviously there's a massive global effort to try and fix and get a vaccine faster. And at the moment, everything's going to plan. I expect that we will see a vaccine that is safe and works towards the end of this calendar year. Then we've got to buy enough of the vaccine to be able to give to everyone, and it will be rolled out with some prioritization. So as you'll understand, the first step is let's vaccinate people that work in our hospitals, the NHS, because they're most likely to be exposed to COVID. Then I expect they will prioritise people whose health conditions make them most vulnerable. So that will be a bit like seasonal flu, and then they'll get to everyone else. But all of that is still being decided. The NHS is working up how would it actually give these injections to millions of people. And they've been asked to look at the difference between how would they do if it's one jab, two jabs close together, two jabs far apart. Does the vaccine need to keep in the fridge or not? Because all of that makes a difference. So when you see the stuff about the NHS planning for vaccination, it's planning. The vaccine's still not ready yet. So I'm afraid we are going to be in this world, I expect, well into the spring next year. So that brings me finally to that final bit of crystal ball gazing about where are we heading and what do things look like. So I think we will see that the numbers of cases continue to rise in Birmingham. I do think eventually we will end up in tier 3. The way I kind of describe it is we're taking our own little gentle time climbing the stairs, and Manchester and Liverpool just rush straight past us. We're still going up the stairs, but we're just not quite at the top yet. But I think we probably will get there over the next couple of weeks. And everything that we each do every day, the decisions we each make when we walk outside of our front door, whether we wear a face covering or not, whether we wash our hands or not, whether we avoid touching our face, and keeping that 2 meters of distance, which is one of the most important things to do. Those are the decisions that help us stop bringing COVID back into our homes. It helps us protect the people that we love. It helps us protect our communities. And most importantly, it protects our city as well. These are the choices that make a difference. They're the choices we each make every day. And that's what I'm relying on, all of you working with me and with the city to keep us safe as we go into this next phase. We are going to get into tier 3 eventually, but it's up to us how long we can delay it. And that's through the actions we will take over the next days and weeks ahead. So I hope that's been a reasonable overview, Councillor, and I'm happy to take any questions you'd like to pose.
Thank you so very much, Justin. And I just want to take the opportunity of personally thanking you for all of the work that you have done. You have been exemplary. You have been quite exceptional, quite outstanding and brilliant in terms of the amount of information you shared, but in a way that is easily absorbable by normal people. And I like plain and simple language. It means that everyone, like myself, can understand what you're saying. So I've just say to you, thank you. And I'm sure that you'll get some wonderful award in the future for all the work you've been doing. And the second question is, are you tired? You don't have to answer the question now. Are you tired? You must be tired because you're a human being. So whilst I pay tribute to everything you've done, the question I have for you is the cultural dynamics. We are in an uber diverse, culturally diverse city. And you and I know that there are certain communities that do not think this COVID virus exists. And I say to them, well, show me the man who made COVID, this so-called man-made disease, and I'll show you God. Because I'm not aware, perhaps you can tell me, of human beings being able to create a virus that actually mutates. So that's the second question. The third question is, how do we therefore dispel the myths? How do you think, because you've been up and down the city, so you know the kind of, do they take vitamin C, vitamin D? Do we take lots of garlic? Do we have lots of ginger? What do we need to do? And how can the diverse communities share constructive information with how they can actually do the social distancing and recognize that this is a very real thing? Fourthly, is that the third one or the fourth one? Fourthly, being of the voluptuous shape myself, Dr. Varney, I get a little bit sensitive when people talk about my voluptuousness. Is there a tablet I can take to just take away the fat that I could share with anyone? If anybody wants to have my fat, they can. It's free collection, that liposuction thing, they can have that as well. And I must also say that in January, I was really, really ill. And I was so ill that I took lots and lots of tablets, and I took Lemsip, and in the full council meeting, I felt myself drifting slightly. For the first time I had to leave the full council meeting, I had the cough, I couldn't breathe properly, I had the high temperature, and I thought it was simply flu. And when I went into one of those aftercare things, they couldn't find anything wrong with me. They couldn't find an infection. So I genuinely believe that I must have had COVID, and I didn't have that sense. I couldn't taste anything. And I stayed at home, and I genuinely, for the first time in my life, thought I was going to die. So I think a lot of people had the COVID and perhaps didn't realize that they had the COVID. So, and the last thing I just want to say to you again, I recognize that you have been more than outstanding, that you have been a clinician that actually cares. So on behalf of the constituents of Bordesley and Highgate, thank you so much for all that you're doing. Just in case you die, we don't get the chance to tell you.
Thank you, and thank you for the kind words, and I appreciate the support. I'm very privileged compared to some of my counterparts across the country to have support from all of the politicians in the council, every party, every constituency. You have all worked very closely with me throughout this pandemic, since those early days when I was briefing about it back in January and early February. So it feels so long ago now. And of course, like everyone else, I am exhausted, but I am taking holidays and short breaks and doing what we all need to do to look after ourselves. And that includes talking about it. I think it's really important we do talk about how hard this is, how difficult it is to not be able to see friends and family. Having moved to Birmingham when I took this job, my parents are down in London, and it's really hard when I'm not able to go and see them. So I live this alongside you, and everything that happens to this city happens to me as well. So I'm definitely in it with you. On the point about the cultural diversity of the city, it's really interesting actually when you look at the demographics of who's catching COVID, it's changed. So when we came out of lockdown, we certainly saw that the largest number of cases were in our Asian community. When we looked at rates of testing, it was actually highest in our African and Caribbean communities, which I don't think anyone expected, and then second highest in our Asian communities and lowest in our white communities. As the numbers have risen, what we've seen is that's changed as a pattern. So now there's about the same number of white people as Asian people who've tested positive in the last week. We've seen that the number of black people testing positive stays about the same. It's not changing hugely. And when we look at that as a rate, because it's important to recognise there are different numbers of different communities in the city, the case rate in our Asian community was going up and then actually has come down. And it's continued to come down. In our black community, it stayed pretty stable, went up a bit, came down a bit, but not a huge change. But in our white community, it's really going up at the moment. And what's really important to stress about this is it's particularly going up in our elderly white community. So where we see the biggest increase in the over 80s who test positive, it is in our elderly white community. And I am very concerned about that. And we do need to do more to get that messaging out. So one of the things is a good plug to ask people to sign up as COVID community champions. And I put the link in the Q&A box for people. This is where you sign up, as anyone can do it, councillors, anyone in the community can sign up. and you sign up and you join, you get text messages from us probably every other day with the latest information. We also have weekly Q&A sessions like this with me or a member of my team, and we also give you more information as the guidance changed, so you can share that with the people you love and care about. And what we're trying to do is really give as much as we can to people to share in their personal networks, because it's all very well Prime Minister getting on the TV and telling you there, and you know, but all of us, the eyes glaze over a little bit after we've seen like the 6th advert for the app. But there's nothing quite like hearing it from someone you truly care about and trust. And that comes to your next point about how do we disrupt some of the fake news, because fake news costs lives. And you know, I am really saddened that we lost so far. About 1,400 people have died from COVID in this city, and that's after they sorted out the data error. Those are people who definitely had COVID within the 28 days before they died, and it's on their death certificate. And they might well have had other health conditions, but they definitely had COVID at that point. And there are really sad cases, not just of people with COVID who died back in May, particularly April and May, when we had some of our highest deaths, but also people who died of other conditions like heart attacks, who didn't call an ambulance because they'd heard a bit of fake news that just told complete lies about what the NHS was doing. And what is sad is because they got that through a WhatsApp group or as a message from someone they loved and cared about, they thought it was true. So they stayed at home, and by the time they did get an ambulance, it was too late and they couldn't be saved. So I would say to people, really, everyone has a responsibility to pass the truth and not pass these lies. There's lots of conspiracy theories. You know, as you say, Councillor, show me the NHS that's smart enough to insert a microchip on the end of a cotton wool swab, because if we could really do that, we would have cured cancer by now. So, you know, I think when you read it and it sounds like it's too crazy to be true, don't pass it on. Stop it with you and pass the truth and things that you trust, because I think that's really important. Moving on to the point you made about your voluptuousness, Councillor. As you know, I carry a little extra weight as well, and I've struggled with weight all my life. And that's why I say, you know, the answer is not to go and do some fad diet, because they don't work. You know, yo-yo diets, the research shows quite clearly that what happens is you lose a lot of weight, you get bored, you can't keep it up, and then you go back to what you were doing before, and you end up actually putting on more than you lost. So the important bit is make the small changes, and make the small changes that make you feel good. You know, for me personally, it's been about committing to going out and having a walk every day. Doesn't sound much, but for the last 6 months, I haven't really been able to leave my flat because of the amount of work I'm doing. So getting out and doing that 10,000 steps walk every day really improves my health, improves my lung capacity, which is one of the things you really want to do, but it also helps keep my weight under control. Now, we have launched a thing called Be Healthy. I put the links in the chat as well. That's on the council website. There's YouTube videos that go alongside that. There are also things like YouTube videos the council commissioned on yoga, on fitness for all ages, things that you can do at home, cooking classes. There's some brilliant stuff from some of the great chefs of the city, like Adam Carter, who've done stuff there. There's also some really good culturally diverse cooking. And it was all designed about stuff you had in your store cupboard. It's worth a watch, if nothing else, to see what Adam Carter does with a tin of baked beans, because it's really quite inventive. So there's that stuff as well. But what I would say is, don't ever beat yourself up for the body that you have. Find a way to love your body and find a way to love yourself, and small changes every day will lead you to a healthier life. If you try and do it too radically, it will become too much. And at this time, when we're under so much pressure and so much stress, living in these difficult times, small changes every day make a difference. I think the final point you raised was about for people who got very unwell in January, and might it have been COVID? Now, there's been quite a lot of work looking at this, because there were people who were in hospital in January with symptoms that people looked at and went, could that have been COVID? And because there are blood samples and specimens that were taken, they've gone back and they've tested. There isn't any evidence that COVID was here in January. There is evidence that there was a nasty round of flu going around. So it may well have been that. And one of the problems we will have over the coming months actually is that more of us will catch common cold, more of us will catch flu, which if you've ever had it is a really, really nasty knock you off your feet type illness, or will catch COVID. And that's a good reminder about, if you are eligible for the flu jab, please go and get it, because you really don't want to catch flu and COVID at the same time, because that will really put you at risk of dying. So I think it is unlikely you had COVID in January. If you want to blow the 150 quid and have the antibody test, be my guest. But I would say even if you did, because we know you can catch it twice, doesn't make any difference now to what you have to do and how careful you have to be. Because the reality is that COVID is about, it is a serious threat. It's not something people magicked up. You know, I think all of us would be really happy if it all suddenly disappeared tomorrow, but I'm afraid it's going to be with us well into the spring. And the more we can learn to live healthily with it, to look after ourselves and to look after each other during this time, the better the city will come out of it, and the more we will be able to keep the people we love safe.
Wonderful. Thank you so very much. I feel a little bit better now, so I won't beat myself up about being slightly, well, voluptuous, not slightly, but voluptuous. And can I just state for those who will be watching this that Dr. Justin Varney is a proper doctor. He's not one of those PhD people in something, you know, table tennis, but he's a proper clinician. So he knows all about what he's talking about. But thank you so very much. This will be circulated amongst those who have not been able to attend this virtual meeting. And as I say, stay safe, and I know you are, but I hope that you take, after this all is finished, you take a long break, because you actually do need one. Because when I see you everywhere, I just think, oh my gosh, this man is like being Lord Mayor of Birmingham when I was Lord Mayor, and I was everywhere, and I felt so overwhelmed. But thank you so much, because you are actually saving lives. And that is a significant achievement. So thank you for coming, and thank you for doing the work that you've been doing. And I pray that God continues to protect you in your task of protecting the whole of Birmingham and indeed the West Midlands. Thank you.
Thank you.
Thank you. And if anyone has any questions, you can put them in the chat, or you can send them to myself, and I will send them on to Dr. Justin Varney. Can I also say that Mark has been kind enough to send us a map of the East Birmingham area, so which will affect you in East Birmingham and those of us in Bordesley and Highgate. Are there any other questions? I can't see anything. The next item that we have is Councillors' update. And I received a call from Michelle Altrick from the Ray Street apartments, complaining of some of the antisocial behaviour that was occurring there. What we've done, we've taken the opportunity of writing to the management committee of the managing agency or board that looks after that area, and we've asked them to actually do something. But Michelle has raised a number of concerns. I've had complaints about, as normal, rubbish. So those matters have been referred to Councillor John O'Shea. So of course there's been issues. But what I'm asking constituents to be conscious of is that we are in COVID. There are staff being affected by this. We've had a number of losses in our families. Some have been unwell. So I'm asking you in this very difficult period to bear with the council. It has not been easy. We had a horrible, tragic event in Chinatown, and I saw it on the news. I was updated, fortunately, by I think I can't remember which officer, there was a walkabout. The leader attended with Chris Naylor, and I went in to see, you know, what had happened. But it was fortunately a one-off incident, and the area is, in parenthesis, safe. But again, let me say to you that there are significant challenges. The fact that we're doing this virtual ward meeting in this way is evidence of the seriousness of this situation of this COVID. And as I say, it's affected everyone. It's affected the way we're doing things. It's affected the resources of the council. A lot of the officers are going out and doing the track and trace. There is enormous pressure on the council officers as they stand at the moment. So I'm asking you to bear with all of us in this very difficult time. I'm just checking if there's any other issues that I need to raise, and there isn't. So I thank the officers, Kay and Pat, for facilitating this. I thank those of you who are listening now and those of you who will listen in the future for your participation and also your involvement. Thank you very much. And that marks the close of the meeting. Thank you very much.